Hello, my name is Gerry Armitage. I'm a Professor in Health Services Research at the University of Bradford, a patient safety researcher and a former registered nurse. This short film aims to guide you in your decision making and management of medication safety incidents. It supplements the quick reference guide, a flowchart and the comprehensive guidance on medication safety incidents called Learning Lessons and Supporting Teams. Patient safety is everybody's business, and medication safety is no exception. Reporting medication safety incidents, indeed any patient safety incident, has the potential for organisational learning, but is often undervalued and fails to fulfil its ambitions. Individual blame is largely futile. We need to know what to report, when to report, how to report, and what action should be taken. This will ensure that a fair, consistent and supportive approach is delivered to all those involved in medication safety incidents. There are high-value learning incidents and low-value learning incidents. Medication incidents are no exception. High-value learning incidents are often as a result of systems factors and may cause harm to patients in the future. You can read more about these in our comprehensive guidance. Let's look at the principles of reporting effectively. First, what to report. All medication safety incidents should be reported via the Trust's electronic reporting system, DATIX, so that we can learn from them. In the real and pressurised world of healthcare, it will be impossible to fully report every instance into a central system that informs the whole hospital. So, as we touched on earlier, we're advocating a practical approach which can be managed in a busy world. Firstly, where you can report medication safety incidents of high organisational learning value, especially when there is a system or process at fault. And secondly, those of low organisational learning value, but with a briefer reporting form and process. The following items need to be considered when reporting. The precise incident type. Is it a near miss or harm event? Think about the former NPSA and now NHS England definition of a patient and medication safety incident. Think about the drug error type. Was it a wrong dose error, a wrong patient error, a wrong route error? Very importantly, do think about the contributory factors. And finally, what might have prevented the incident occurring. Clear, concise language is essential throughout. Who should report? Ideally, the person closest to the medication safety incident should report it. If this person is not aware of the incident or error, another person might have to report it. When to report? As soon as possible, and when it is feasible and safe to do so, preferably the same day that the medication safety incident was discovered. How to report? Follow the questions in the quick reference guide on medication safety incidents. If you've answered yes to questions 1 to 3, then the medication safety incident needs to be reported on the Trust's electronic reporting system known as DATIX. There are prompts and guides in the DATIX system to help you through the reporting process. What action to take? This needs to be timely to minimise the potential of recurrence and any potential harm. The impact on those involved, very importantly, needs consideration. The patient and/or family need to be made aware of the incident. The action taken should be reflected in your response to questions 1 to 3. If yes to any of these questions, then an organisational or trust-wide review should be undertaken. Documentation templates are provided within the DATIX reporting system to help you capture the action taken and the learning. Some incidents arise from people who demonstrate unsatisfactory levels of competence or inappropriate intentions, which can result in a medication safety incident. This requires following the Trust's disciplinary policy and procedure. More commonly, of course, it was recognised that competent professionals can make mistakes and may even develop unhealthy behaviours, for example corner cutting, often with the best intentions to help patients, and these can then become normal and prove to be a risk. There should, however, be zero tolerance for reckless behaviour. We are aiming for a just culture rather than a blame culture, so as to improve our learning. At Bradford Teaching Hospitals NHS Foundation Trust, we are aiming to promote a strong reporting culture and encourage our staff to report incidents so that we can minimise the risk of future similar incidents occurring, learn at all levels, as an organisation, as a ward, and as individuals. Thirdly, effectively support our teams throughout the reporting process. Again, refer to the quick reference guide and comprehensive guidance for more information. The Trust has also set up a learning and surveillance hub, which produces a Learning Matters Bulletin in response to learning from incidents and quarterly newsletters called Responding and Improving, to simply describe how the Trust have responded and what actions have been taken to reduce the likelihood of an incident recurring. For more information, please contact learning.matters@bthft.nhs.uk. You can learn more about medication safety incidents by reading the e-learning resource that accompanies this film. Thank you. And finally, a message from Erin.
Reporting errors is really important. It could be me or my family that is affected by an error, and we, like you, would want to learn how and why it happened, but also how we can prevent it happening again. Thank you.